who was Nanok, and the CS for Health, who was Dr. Mailu, and of course the Minister of Labor. Now, all the two levels of arms of government signed that deal at the highest level, and the president promised that he was going to fund that agreement, only that we were not to have it implemented immediately in 2017 because of budgetary system and financial constraints. And then we agreed with the government that we were to implement that return to work agreement in the 2018-2019 financial year. Yeah. And actually the money was factored in the budget. There was an increase in the money that was given to the county governments. But when it came to implementation, there was no implementation, was not forthcoming. When we threatened to go on strike, His Excellency, the governor, the chair of the COG then was the current one, Governor Paranya. He came and said that let us go to the county government and resolve this issue at that level, so that each county to address the issue of the return to work agreement, because it has already been executed by the two levels of government. Yeah. When we now went to the counties actually started honoring the return to work agreement. We had about 10 counties that had already paid, including Machakos, Mombasa, Kilifi, Vihiga, and the rest. When Council of Governors Secretariat realized that actually county governments are starting to pay this money, they wrote a letter saying that the county government did not have the money. When we asked them, where are you getting this notion that the county governments don't have the money? And they have written letters saying they have factored this money in the budget as it was agreed. It is only waiting a go-ahead by the SRC. Then you told us, let us go to the counties. Now they are paying. You are now coming in to politicize and say that they do not have the money. So we have a lot of intrigues which may not be the correct one for this platform. But apart from the political administration system of this country failing to address the public health care system, we also have the aspect of corruption that has come in, that is fighting back, because my union is known for standing firm and fighting against corruption. And I'll mention one of the areas that I think has affected my union so much is the stand to defend the healthcare, the pension scheme for county government employees, which we call lab trust, that has actually gone completely. It has been turned into a private entity completely. Now it's called County Pension Fund, from a public entity to a private entity. Workers are staring at losing their pension scheme completely to some crooks within the government system and without the government system. I have opposed that, and I think that one is the one that has played a crucial role in ensuring that nothing goes the way of the nurses, because I was promised on the table. Yeah. I was told by the chief officer COG on the table when negotiating the CBA that if you don't allow to have lab trust transit to CPF, which is a private company, you will never see the CBA. It has come to pass. From 2014 up to now, we don't have a CBA. Yeah. And then you are saying you have a government in place. If we have a government in place, that government should be telling us why we have a pension scheme that's a public trust. Yeah. It has been turned into a private trust without following due process of the law and without even involving stakeholders. Okay. No one is caring about that. So corruption has played a major role, and that is why sometimes you sit and ask yourself, do I really need to continue fighting graft when even the officer of the Attorney General is supporting that graft? Auditor General is supporting that graft, because when I went to court, I sued all arms of government. Do you know what the judge said? The court tells you it does not have the mandate to handle the suit, because there is a clause in Retirement Benefit Authority which says if a member has a complaint, you complain to see the chief officer, RBA. But you are complaining about serious constitutional matters, laws that are supposed to be dealt with by the court. The CEO of RBA cannot interpret law, cannot even declare a provision of the law illegal. But a judge says, I cannot go into the substance of this matter because I lack authority. And the Attorney General is on record. ESCC is on record. Auditor General is on record. It's a public trust that has never been audited for the last 20 years. It has one CEO more than 20 years. Okay. So that is one of the major aspects that has corrupted almost all arms of government that are responsible for ensuring that nurses have the right, from SRC to COG to even they had dropped in Commission for Revenue Allocation. Yeah. So actually one of the main functions, the main reason why nurses are not getting what they get is for my position to stand and fight to defend lab trust as a public trust, so that those who retire don't suffer.
Dr. Mochonda, are the issues the same? Because, you know, Kenyans are a bit mixed up here. Doctors have their own deal, clinical officers have their own issues, and then nurses have their own issues. Aren't these issues supposed to be amalgamated and sorted out as the health sector?
First and foremost is to say that as doctors, we have a CBA signed in 2017, I think after the 100-day strike that we undertook, and that CBA is very explicit. It has not been fully implemented, but it has been implemented to some extent. As we speak already in court regarding its implementation, non-implementation, and it's a matter that is going to be decided by the courts now this month. But more importantly is to say that apart from the other issues that are in the CBA, we got through a situation last year when we got COVID in the country. And that COVID situation really highlighted the need for the welfare, safety, and occupational health of our doctors and other healthcare workers, including my brother Seth and his members. And this situation resulted in what you're now seeing, in which we discussed in terms of occupational safety and health. One is the issue of getting COVID and dying at the workplace. And this brought the fact of the compensation that is through the Work Injury Benefits Act and the group life cover and the last expense that came on board. And the national government came out, the president directed and gave out the welfare package that was eventually unveiled in November of last year. Now that package only covers, as we speak, national government employees, that is the civil service. So our members in the counties are universities who are equally exposed to COVID, and currently we've lost very senior specialists in this country, are not going to get compensated because of that exclusion. And that is one of the issues that then now comes on board and now becomes the same as the nurses and the clinical officers. And then secondly, of course, is the issue of the risk allowances that our colleagues have also spoken about, that were really very well canvassed by even the Senate Committee on COVID-19, and the Senate Health Committees, the National Assembly Health Committees listened and actually agreed that these allowances should be paid to the healthcare workers. Third thing is, of course, the issue of welfare in terms of the provision of personal protective equipment for the doctors, nurses, and clinical officers and other other healthcare workers in the counties and national government. Initially there was a global shortage, yes, but in the country also, issues of corruption. And we saw this play out through the COVID-19 cancer scandal, where up until to date, it's not really clear whether these PPEs have been released to the counties or not. And so the systemic issues of corruption coupled with the COVID-19 resulted in another scenario where healthcare workers were on the front line, they were at great risk of contracting COVID-19, and this now brought emerging issues sort of situation. Now, in a pandemic, and in which healthcare workers are frontline soldiers, there must be an enabling environment to facilitate them to do their work. What we saw last year, and now what we are seeing this year, it's even getting worse, is that apart from the COVID issues, the underlying issues that have always been there should have been addressed. If it's salary payments, they should have been paid in time. If it's allowances, they should have been paid in time. You know, there should be no exclusion in terms of implementation of all these factors of the welfare of the healthcare practitioners. So you can imagine you're in a pandemic, and then apart from the stressful situation you're dealing with at the workplace because it's a pandemic and you're at great risk, the environment does not facilitate you, does not offer that, the conducive environments, the working environment that is required for you to offer your services. And that is what resulted in the industrial actions come the end of the year in 2020, which is still ongoing up until now.
But Nako, you know, I'm looking at the letter that was written by the COG, Council of Governors, to the Waziri after deal was struck. And part of it, that is paragraph 3, says there are county governments where there were no strikes at all, and the issues raised in the return to work formula have already been addressed with the different measures, negating, therefore, the purpose of a centralized return to work formula. Should these issues be handled county by county?
if there is any other time that the need to have the Health Service Commission has come out very clearly, it is during this strike that is ongoing. Because we have a national government that is saying, yes, we are going to look for the funds to finance the return to work formula. And we have a county government saying, governor saying, we do not have the funds to finance the return to work formula. We have county governments that are speaking from both sides of their mouths. The other day they were saying that the issue of risk allowance and Health Service Commission was an issue of the national government. Then the CS for Health says, look here, I have spoken with the powers that be, and we have agreed that indeed we have looked at the demands for the health workers. They are valid demands. We are now going to make sure that this money is factored in the budget. And that is why the issue of timelines on when the risk allowance was to be implemented became a thorny issue that parties had not agreed. And by the time we were agreeing, when we agreed, we said now, let us remove the issue of timeline. Let us agree that this money will be implemented after we had listened to the government carefully what it was saying. Because this money was to be up and above the allocation that goes to the county government. It was not going to be taken from the county governments. On realizing that now the national government has yielded to the fact that let us have the risk allowance go to the nurses and clinical officers, now Governor Paranya and the COG, they shift now their position. They start saying that, look here, let each and every government, county government, tackle these issues. The issues of the health sector are equal across all the county governments. The fact that some branches, some counties may have not gone on strike, it is not an indication that the issues have been resolved. Initially, they were saying that they had medical cover in place. They had group life insurance in place. They have comprehensive medical insurance in place. But now when you look at that letter keenly, Governor Paranya is now saying, even yesterday you saw when he said in Kakamega, he's busy running in the village and the health sector is collapsed. In Kakamega, there's no single health facility that is running. And yet my governor, Governor Paranya, who's also my friend, is running riot in the village, establishing village elders and councils to manage what if the health has collapsed. He said that they do not have money. It is very devastating what he said yesterday. They do not have money to compensate families of those nurses who have died. They do not have money to implement comprehensive medical cover, leave alone even risk allowance, which is an increase. We can even say risk allowance and increase, let that one stay aside first. But if I cannot afford the healthcare services that I'm giving Kenyans, how justifiable is it that governors can come and tell the public that they are justified to say we should continue working when we don't have comprehensive medical cover? And you see, this comprehensive medical cover is not free. They already took medical allowance that used to be on the payslip of the civil servants during the time of Honorable Raila Amolo Odinga when he was the Prime Minister. Yeah. And this is actually a funded program by the workers. The workers' money was taken to go and fund comprehensive medical cover and group life insurance. Now we are being told that your medical allowance has gone, but we do not have money to actually have that services that we are paying for implemented. So right now, even if you go back to work, we do not have group life insurance, we do not have comprehensive medical cover, and we are being told by the governors that they do not have money. To some extent, it is true. If they don't have money, the fact is they may not implement anything. But you see, when Governor Paranya says that they have not received their allocation for the last 4 months, whose problem is it? Is it the workers' problem? Is it true, is it right for this government, the leaders that are in charge of this government, to leave a very important department like the Department of Health to be found in between the crossfire of the national and the county governments? Because if the governors are saying they have not received money for the last 4 months, then it follows true that they cannot offer any services. But then the question comes in, why do we have to take healthcare services to the county government if they are not able to have consistent flow of the funds? Yeah. Why? You saw even Governor Paranya say yesterday that we have no problem with payment of salaries at national government. So he was wondering, why do you have problems with payment of salary at the county government? Because money is not going there. The question we'll ask as health workers and Kenyans is, do we need to have health sector in the hands of the people who are not having the funds consistently? That's the question we need to ask. Yeah. And therefore, according to me, this strike has brought out what Kenyans need to know. The governors have spoken. They have said they're not able to handle the healthcare system because they do not have consistent flow of funds from the national government. I don't think anyone else in this country wants interruption of healthcare services even if it's just one day alone.
Okay, I have to take a quick break here on Daybreak, and I see Bobo Wino is actually alluding to what you just said, Panyako. He says on Twitter that health docket should be taken back to the national government to end this menace, which is a clear indication county governments have failed to run the doctors approving, and it's what they want. All right, we'll come back with your feedback in just a bit. We're taking a quick break here on Daybreak. When we come back, Peterson Washira is here now, the chairman, Kenya Union of Clinical Officers. We're getting the end-to-end conversation of the healthcare crisis from the clinical officers, the nurses, and the doctors. We want to find out from them what the issues are. Governor Lee Kinyanjui has sent in an apology. He's not going to be able to join us this morning. However, some governors have been quoted to say that the health strike as it is right now is illegal. The governors themselves through the COG are saying that they don't have the money to implement the return to work formula. That is what we're discussing in just a bit. All right, see you soon.